Afternoon, everyone. We're going to get started.
Hey, Sheila. Come on, Sheila. He's just chatting right here. John, who am I following? Don't get nervous. No pressure, right? Jen, Mayor, Jen, Jared, and then I'm done, right? Yeah. All right, thank you. It's all your show.
All right, let's do it. Okay. Hello. Can you hear me? Hi, my name's Jen Tracy. I'm the director of the City of Boston's Office of Recovery Services. Thank you for coming here today for this important announcement. While communities across the U.S. have struggled with substance use and addiction for decades, our nation's opioid problem has become an ever-growing and overwhelming epidemic. Last year, drug overdoses killed over 72,000 Americans, the majority caused by opioids. This is higher than any year from HIV, car crashes, or gun deaths. Against the backdrop of this epidemic, and in keeping with his lifelong commitment to substance use and recovery, Mayor Walsh created the Office of Recovery Services early on in his administration. We are the nation's first and only municipal office focused on substance use and recovery initiatives. Our office works to ensure that every step of the care continuum is as comprehensive as it can be. From prevention to harm reduction to long-term recovery supports, we think about the whole picture. It is our job to fill gaps that keep people from accessing the care that they need. Addiction not only affects individuals and their families, it affects whole communities. That is why we work closely with other city departments, local providers, the business community, and constituent groups. Just as readily as the opioid epidemic has overwhelmed every system, our community has banded together to come up with solutions. With our partners, we are addressing addiction broadly through reentry, workforce development, even public art, always thinking about social determinants, equity, and disparities. While we think boldly and strategically, we don't lose sight of day-to-day quality of life issues that affect our neighborhoods. That is why the mayor has invested heavily in street engagement, cleanup, and public safety. It is difficult work, but we continue to use every tool at our disposal. While I have the honor of speaking about some of our collective efforts today, there are many people here who have been impacted and have stepped up to do their part. This is a team effort bigger than any single department or organization. I would especially like to recognize and thank the often unsung frontline workers in this neighborhood and across the city. They are the ones that meet people where they're at without judgment. They are the ones who reverse overdoses and save lives on a daily basis. They are the ones who stick with our city's most vulnerable people no matter what. Now, it is my honor to introduce a leader who embodies and believes in second chances. Since before substance use was a national priority, Mayor Walsh was a tireless advocate for people struggling with addiction. Sometimes that meant securing funding for recovery high schools as a legislator. Other times it meant driving someone to detox early on a Sunday morning. Whether through policy or personal relationships, his life has always been about service, first and foremost. Please join me in welcoming Mayor Martin J. Walsh.
Thank you, Jen. And let me just start by thanking Jen and the Office of Recovery Services. Jen already thanked all the people here, the staff. Thank you for the work you do. The intake coordinators, the counselors, the folks that pick the needles up, the folks that pick people up, the folks that say hello to somebody, the folks that serve the food, the folks that try and comfort somebody before they go to bed if they're in our shelter or on the street. I want to thank you for your work, because those stories don't get written. Those stories don't get told. Those stories aren't part of the daily conversations that we're having. So I want to thank you for all of your work. I want to thank everyone at the Public Health Commission for the work that you do. The team at Woods Mullen, thank you for having us here. The guests, the residents of Woods Mullen, thank you for letting us share your home today and your parking lot here today for an important announcement. I want to thank, I'm not going to thank everyone behind me, but I want to thank Michael Botticelli, who's the director over at the Graken Center for Addiction at Boston Medical Center. But I met Michael when he worked for the Bureau of Substance Abuse Services at the state. I worked with Michael when he was the commissioner of the Bureau. And we had many conversations about halfway houses and about detoxes and about holdings and about getting people into treatment and fighting off stereotypes when it came to methadone and Suboxone. And we had those conversations. I want to thank Michael for his great work. I want to thank Maisha Menta-Jordan, Dr. Maisha Menta-Jordan, President and CEO of Epidemic, who runs a group of programs, a continuum of care, where all of your needs are met on the campus. You go from detox to holding to a halfway house to reentry, get your medical care, and help people get back their lives back that they lost for the period of time that they were addicted. I want to thank you for that. I want to thank Jared Owen, who I'm going to introduce in a few minutes, a survivor and advocate, and I want to thank you, and I'll get to Jared in a minute. Today, the city of Boston, we took historic action on our fight to end the opioid epidemic. We filed litigation in Superior Court against 13 manufacturers, 4 distributors, and 1 local doctor. All of these companies and the people behind these companies have played a major role in creating the substance abuse crisis that we're seeing today. These parties have marketed opioid drugs in misleading and in dangerous ways. They have failed to report suspicious orders and shipments that were diverted into the black market. Simply put, and we've heard this before, they put profit ahead of people, knowingly fueling addiction at the expense of human lives. The city of Boston has responded to this crisis by building one of the strongest recovery systems in the nation. We're addressing it from every single angle, through our Office of Recovery Services, with our police department, our fire department, our EMS department. We're getting people the help that they need. We built an engagement center across the street in one of the hardest hit parts of our city. And we're rebuilding a bridge to Long Island and investing in a comprehensive long-term recovery facility that will serve the entire region, not just Boston, Quincy, and the entire region. Throughout all of this work, We have improved and have to continue to improve the standard of care. We have made it easier for people that need the help to get the help. And there's no question that we have all collectively, and a lot of you individually, have saved lives. But the fact is, the pharmaceutical industry is still not doing enough to address the root cause of this issue. City departments and taxpayers are shouldering a burden that they did not create and do not deserve. The Boston Police Department, Fire Department, EMS, and Public Health Commission deal with this issue every single day, and it's affected nearly every other city department as well. Our librarians have dealt with overdoses in the bathrooms. Our Parks Department staff are dealing with needle pickup every single day. Teachers have young students who are neglected at home because their family has the sickness and the addiction, this disease. It's an estimate that since 2014 alone, the city has spent over $64 million to combat this epidemic just in Boston in the last 3.5 years. More important than any price tag that we could actually put on a face is the human cost of this epidemic. When we drive through Melina, Cass, and Mass, people say it's awful and it's terrible and you need to do something about it. And what we see is the face of what's happening. We see that this catastrophe is tearing these loved ones that are here away from their families. The picture here is showing that what a shattered life looks like. It also can show us that it's a generational issue. Kids growing up without parents, kids growing up without guidance because their parents were lost to this horrible epidemic before. And it also shows that it can take decades for these families to fully bounce back. These manufacturers and distributors need to pay for the damage they have done, or else we're going to continue and always cleaning up their messes. As they're on their boats and their yachts and their fancy houses and their fancy apartments with their fancy clothes and their fancy cars and their fancy expense accounts and eating in the fancy restaurants, we built an engagement center over here so we can give somebody a meal. We built an engagement center so somebody can have a bed. And they have to understand that. Here's what we hope to achieve. We want these parties to reimburse us, all of us, for the costs that have already been put out. We also want them to pay for the future costs, which we will be incurring in the city of Boston. We want them to support our long-term efforts to help people in recovery and get people into recovery. And we're not going to let them walk away from this. We need to make sure that they're held accountable so that our city can move forward and that the individuals that we see on the streets can get peace in their body. The city of Boston has selected Motley Rice to represent us in this litigation. They're a firm with a strong track record of helping state and local governments hold pharmaceutical industry accountable. We believe that this will lead to real change. We hope that the defendants accept this opportunity to do the right thing and help our communities heal. This lawsuit is not about money. This lawsuit is about lives. This lawsuit is about ending the problems that we have and people acknowledging what they did wrong. Before I hand it off, I want to speak directly to anyone here today who's struggling with addiction. Most of you know, but some people might not know, that I've been in recovery myself for over 20 years. I certainly know how easily addiction can take hold. I want you to know there's hope. Don't hesitate to ask. That empty pit feeling in your heart and in your soul today, rather than curing it by drinking or taking drugs, put your hand out and talk to somebody. And as I look out at this crowd today, there's probably about 50% of this crowd is in recovery. I'm not breaking who you are, but if you reach your hand out to somebody, there's a good chance you're talking to another alcoholic or addict that's in recovery. So make sure you do that. September is Recovery Month. Our entire city is working together to make sure that you get the support that you need. We're fighting the stigma around seeking treatment. And today we're closer than ever to getting justice and creating a better future for you and your family, for people in Boston and people all across this country. Now it's my great pleasure to introduce a great community partner. He's a survivor, someone who understands how addiction can take over your whole being and your whole family and your whole community. Today he works for MORE, the Massachusetts Organization for Addiction and Recovery, helping other people reclaim their lives. Please welcome and join me in welcoming Jared O.
Good afternoon. I'm very grateful to be here. My name is Jared Owen, and I work for MORE, the Massachusetts Organization for Addiction Recovery. My story with opioids begins when I'm 14 years old. I dropped a dumbbell on my big toe and I went to the emergency room. I got a prescription for 60 opioid pills with a refill. Although I didn't become addicted right away, I fell in love with the way those pills made me feel, and I see this prescription as a turning point that started an obsession that would years later lead to disaster. While I was in high school, I remember stealing OxyContin pills from my family's medicine cabinet and sharing them with friends that were doing the same. When I was in graduate school at MIT, my addiction escalated. To cope with feelings of isolation and depression, I began to use these pills more and more. They were widely available, but they were expensive. Within a year, I had a serious habit. I could not imagine my life without the opioids, but all my savings was gone. Like so many other people, I turned to heroin. Even in the depths of my heroin addiction, I still would have chosen to use prescription pills were they cheaply available. These drugs are just as powerful and addictive as heroin, plus they offer a predictable, unadulterated high. The influx of these drugs into our medicine cabinets and streets in the late 90s and early 2000s has led directly to the opioid epidemic that is devastating my generation. I firmly believe that there are men sitting in corner offices in these companies who have more blood on their hands than any other drug dealer in Massachusetts, and they need to be held to account. Within 6 months of switching to heroin, I was injecting, using chaotically, and committing crimes, doing things that I would never imagine doing before my addiction and I can't imagine doing now. But I was very fortunate. I had 3 guardian angels. Unfortunately, they were dressed up like Cambridge police officers, and they didn't treat me very nicely. But my life was saved. I spent a total of 18 months incarcerated. This was early 2013, and I say I was fortunate because later that year, the synthetic opioid fentanyl would hit the streets in earnest. And if I had been using during that time the way I was using before, I know that I'd be dead today. I was also fortunate to have family support and a very good lawyer. I was released to a treatment program called the Meridian House in East Boston that saved my life. I found that I had so much in common with the people there, and I found people, especially my counselor, who showed me unconditional love and support. People in recovery lifted me up and showed me that there is a better way of life. I learned that I could be happy without using opioids or other drugs. I think everybody deserves this chance. One day at a time, my story has a happy ending. I've been in recovery for 5 years now. My life has improved in ways that I could never imagine. Recovery has given me a new sense of hope and purpose. I was able to go back to MIT last year in 2017 to be granted my master's. I work for an organization that I love called MORE. Thank you. I work for an organization that I love called MORE, where I have a privilege to be able to advocate for improved addiction treatment and recovery services so that more people can get the opportunity that I got. At MORE, we believe in speaking out about our experience to reduce stigma, to raise awareness, and to demonstrate the value of recovery from addiction. My largest accomplishment in recovery is that I've become a father. I now have a very precocious 18-month-old son. I will do everything in my power to make sure that he does not go down the path that his dad took. However, if he does, I'm confident that he will be able to find help without facing the shame, stigma, and suffering that I did. And that's because of leaders like Mayor Walsh, organizations and agencies like the Office of Recovery Services, the Graken Center, Boston Public Health Commission, our Bureau of Substance Addiction Services, and more, who are taking this epidemic head on. Lastly, as Mayor Walsh said, to anyone out there who is suffering, or anyone who has a loved one who is suffering, there is hope. There is help available, and recovery is possible for anyone. Thank you.
Thank you so much, Jared. It is Recovery Month, and we want to reiterate the fact that there is hope for folks out there. Next, I would like to welcome Dr. Maisha Minter-Jordan. Maisha is the president and CEO of the Epidemic Center, a community health center and recovery campus that has been working at the front lines of the opioid epidemic. Maisha has tirelessly advocated for Boston's underserved neighborhoods and has built strong partnerships across the city. I am so grateful for her continued collaboration with our office and her leadership in our community. Please join me in welcoming Dr. Minter-Jordan.
Good afternoon, everyone. I stand before you today as a mother, a sister, and a physician leader. And I bring all of those perspectives to the work that we do at the Epidemic Center. As a mother of 2 children, of 2 girls, my greatest fear is that they would succumb to this disease. As a sister, I have experienced firsthand what it can do to a family when your sister is addicted to heroin. As a physician leader at the Epidemic Center, it's my goal to make sure that our continuum of services provides access to those in need. And I'm incredibly grateful to the Mayor and the Office of Recovery for inviting me here today. As a physician, I remember in working with pharmaceutical companies when the pain scale was introduced. And when we began in our training to learn that if we did not assess the patient's pain and make sure that they had 0 pain, that we were not doing the job of a physician. And that's when the opioid epidemic began in many ways in my memory. I remember being pushed to prescribe opioids for our patients, whether or not they truly needed them, and being engaged on my work as a physician in doing so. And so I stand here proud of the effort of the city, of the Boston Public Health Commission, of which I'm a member, in holding pharmaceutical companies accountable for that, accountable for the lives lost, the lives impacted by this devastating disease. And I remain committed as a physician leader at the Epidemic Center to ensuring that we provide access for all. I think many of us can remember when the face of addiction looked very much like mine and mine alone. Things have changed. And many people have been affected by this disease. And I would say the faces of addiction are reflected in every one of us here today. If that now means that there's greater attention to this disease and greater resources for this disease, then we will take that. And we will make sure that all people have access to the services that they need. And I appreciate the Mayor's office for helping us to do so. The Mayor was instrumental in ensuring that we could expand the services of our detox center that now treats over 4,000 people each year. But that is not enough. We need to hold the companies accountable, we need to continue to expand on the services provided, and we need to continue to enforce these laws that help to protect the people that are most in need. So I thank you for being here today, for supporting our efforts from both the Boston Public Health Commission and the Mayor's office, and know that we stand united in this fight against this disease. Thank you so much.
Thank you, Maisha. So next, I would like to welcome Michael Botticelli. Michael works right across the street as the executive director of the Graken Center for Addiction Medicine at Boston Medical Center. He is a national leader in the fight against the opioid epidemic, having served as the Office of National Drug Control Policy Director at the White House under President Obama. Through his advocacy, he helped our nation understand that addiction is a disease, not a moral failing. I had the pleasure of working under Michael when he directed the state substance use services, and I'm so happy to have his leadership back here in Boston. Please join me in welcoming Michael Botticelli.
Good afternoon, everybody. Really privileged to be here today with a mayor that I have worked with for a very long time to improve conditions not only here in Boston and in Massachusetts, but across the country. I am proud that I work in a city with a mayor who's openly in recovery, and I will never forget the day when I was watching the Democratic National Convention and I heard a courageous person step to the microphone and say, "My name is Marty and I'm an alcoholic." I don't think that we can underestimate the profound effect that it has when we destigmatize this by having our nation's leaders talk openly and publicly about the fact that they're in recovery. I joined the mayor today as one of those people who are not so anonymous about my own recovery. And I also want to thank Jared. You know, after almost 29 years in recovery, I've probably heard about over 10,000 stories of people in recovery, and I think you would all agree that those stories never fail to move us, as they well should. I want to thank the mayor's entire administration for the work that they do, and want to just reaffirm our commitment at Boston Medical Center and at the Graken Center that we stand as trusted partners in the work that they are trying to do. The opioid epidemic has inflicted unprecedented suffering on the people of Boston. Boston Medical Center sees this every single day throughout our hospital, from the patients who are brought to our emergency room and in our outpatient clinics, to the babies born with neonatal abstinence syndrome. This epidemic has placed an overwhelming demand on our treatment services, and the Graken Center is proud to support the mayor in his efforts to bring this suffering to an end, and to show our support for his actions today to hold manufacturers and distributors responsible for their role in creating this epidemic. You know, all too often society blames and shames people with addiction, saying they did it to themselves or that it was their choice to become addicted, rather than putting the blame squarely on where it belongs. This epidemic was fueled by the profit-driven motives of manufacturers and distributors of opioid medication who, despite all the evidence, promoted and distributed their products as safe with little to no potential for people to become addicted. For too long, our cities and states have borne the burden of this response to the epidemic, and it's time to hold those who earned billions and billions of dollars off of people's pain and suffering, to be held accountable for their actions and to pay the price for the crisis they have caused. Boston Medical Center applauds the actions of the mayor has taken today, and we join him in our collective efforts to put an end to this epidemic. Thank you very much.
There's a couple people. I want to thank all the speakers. Jared, in case you missed Jared when he talked, he's a class away from graduating MIT and a master's, so congratulations. You're doing all right there. I want to thank the providers that I didn't thank, the providers that do this work every single day. Victory Programs and Pine Street Inn and some of the other halfway houses that are here. These are programs that I met when I was a young state representative and helped push me and focus on how I would take this fight on, so I want to thank you. I want to thank City Councilor Nisha Sabi George, who's with us today. Thank you, Councilor George, for being with us today. And lastly, I want to thank the community. I was at the Southland Forum this week, and I know some of the residents are here, and we invited you, and you're here. And to be honest with you, there's probably not many other communities in the city that have more impact than with all the programs around here than you. And I want to thank you for graciously helping us and working with us and being patient with us and the people in the community who are sick and suffering. So thank you to the South End community as well. And with that, if there's any questions from the press on this topic and for any of the speakers, we'll gladly take it.
How does this lawsuit coincide with some of the others in the Attorney General or the one in federal court?
Yeah, the question, just for the folks that are here listening, is how does this lawsuit compare to what the Attorney General's actions are or federal lawsuits? And they're all the Attorney General, first of all, doesn't have a lawsuit yet. What she's doing is working with 40 other states around the country, and they're coming up with an idea. And we had many conversations with Maura Healey about this to let her know what we were thinking of doing, and we wanted to make sure that the impact that we want to do here would not contradict anything that she was doing. And we both agreed at the time we both should move forward. This case is being driven for us by Boston and cities and towns across America. They're driving their own individual cases. At some point, I guess it potentially become a class action lawsuit, but as of right now, it's an individual lawsuit. I don't have that answer. Let me find out. We'll get the information to you. I don't have. We'll get because it's all public. Again, we're going to get a briefing to you from the attorneys. I mean, they're the biggest offenders of pushing drugs. If you understand this area, what was happening was a lot of these companies were hiring people, pushing salespeople to go to doctors, to push them to sell these drugs, to push them as giving them out. Dr. Menta Jordan talked a little bit about her experience at her health center, that where doctors understood the impact of these drugs. You got to remember, a lot of this stuff happened before legislation passed that we had to educate doctors on addiction. So doctors were being convinced, and again, I should be talking to the lawyers will probably grab me on this, but doctors, in my opinion, doctors were being pushed by these pharmaceutical companies to push these drugs out, and they were giving them out literally like candy. Anyone who was kind of figuring out the best way to kind of surmise what's happened, there's a book by Sam Quixote. It's called Dreamland. I'd suggest you buy that book, and it'll talk to you about, it'll show you exactly what was happening in the Rust Belt mostly. But it was happening in the Rust Belt, but it was also happening in Boston, and it was happening in LA, and it was happening in Miami, and it was happening all over the country. So again, we'll get more information with the lawyers. We'll make them available to you.
How much are you looking to get the $64 million cost? Is there...
I'm not sure what the exact number is. I think it's $65 million is what's in the lawsuit, but I think as we uncover, I mean, we have to provide information. What we've been doing since we decided to do this, we've been gathering information and working with deep public health, working with police, working with fire, working with hospitals, working to try and accrue some costs. But again, we can get all that stuff to you later on. The question is, if this litigation takes a long time, what are some of the short-term solutions? This litigation probably will take a long time, because anytime you're dealing with the courts, it's going to go on and on and on. There'll be appeals. But we're not waiting. I mean, I think we talked a little bit about today what we're doing. We created the Office of Recovery Services in 2014. We've made major financial investments in our public health department. We're working with our providers, making sure that we create more opportunities for beds. We're working with the state on legislation that they passed on strengthening the prescription monitoring program, and also doing education for doctors who write scripts. That was not part of the law. All these young people that became doctors, they didn't learn about addiction. They weren't taught about addiction. They were taught about how to administer pain meds and treat people. Now we have a program in Massachusetts, thanks to the legislature and the governor for passing that. We're adding addiction counselors. We have A-Hope, which is our program here. We're working with some of the other programs I talked about. So we're not standing pat. We're going to continue to move out. We're working on education programs. I was in a high school today talking to young people about what addiction means and what the face of addiction is, because you don't see it. No addict wakes up in the morning and says, nobody who becomes an addict wakes up and says, well, I think I want to be a heroin addict today. Oftentimes they might see it subconsciously in their family or in the community, and it's that first pill, as Jared talked about, that first pill that makes you feel good, or for the alcoholic, that first drink that makes you feel good, that tingle in your belly. And we got to have to go out and fight that. We have to go out and talk about prevention to young people, and we have to get out there and talk to people about what this disease does kill. There is nobody that's on Melnina Mass app today that their aspiration in life, if somebody asked them in high school that they want to be hanging here and becoming a sick and suffering addict or alcoholic. That's not their dreams and aspirations. So we have to continue to work to try and not just fight the stigma, but also fight for prevention.
So many of these lawsuits tend to end in settlement. Is it more important to be recouping some of these costs, or to make an example out of these drug manufacturers and distributors?
The lawyers probably want to bring the costs, and I want to make an example, quite honestly. I remember having a meeting in my office when I was a state rep at Purdue Pharma. And I had some words with them in the office, and I challenged them and Marty Walsh said that they were killing people, and they left my office all upset and disturbed. Not too long after that, there was a class action lawsuit settlement that talked about them by giving out drugs to people that didn't need them. The companies have to realize that. I don't feel bad for the CEOs of this company. I don't care if they see this and they never talk to me again because I don't even know them. I don't care about that because they're not understanding the loss of life that's happening here on the streets. And if they do, they're ignoring it. And it is about sending a strong message across the United States to every pharmaceutical company across this world that we appreciate the work that you do. We appreciate you finding cures for diseases. We appreciate you finding opportunities to reduce pain. But we don't appreciate you taking advantage of a whole bunch of people by using your drugs to get rich. Just by the sheer fact that we're here. I mean, this is a recovery mile, formerly known as methadone mile. You look around here and you see the institutions that have been doing this work for a long time. You have BMC across the way that's doing incredible work in so many different areas. Mike Botticelli's from there. You have a Boston Public Health Commission that's right here at Woods Mullen, our home for women who are homeless. Behind us, we have the men's home across the way. We have the drop-in center. We have healthcare for the homeless. We have Pine Street Inn. We have recovery halfway houses in the neighborhood. We have Rosie's Place right down the street that's working to help people get into recovery. So when you think about this area is really has all of the programs. Phoenix was here for a while over in the gym, and now they're going to a new joint. There's a lot of programs here that are fighting this addiction. But it's important for people to understand the face of addiction. And the face of addiction for a lot of people is their loved ones in their home. And they don't want to talk about that, but that's the face of addiction. But also when you think about this as not individual situations in your home, as a whole piece of it, this is the face today. And our job is to get the people off the street, but our job isn't to get the people off the street by hiding them in the building. Our job is to get people off the street by getting them into programs, into recovery. And that's what we're going to continue to do. And that's why we're here today. Sir, do you have a question?
Well, yes, just one observation. The owners of Purdue Pharmacy have their names on buildings all over this area.
I know.
Are you going to tackle that and tell higher education people that these are just so they're not dressed?
Yeah, I don't think I'm not going to go into start taking names off buildings. But what I am going to do is we're going to make them pay for not having names on buildings, but make them change their cultures. And we don't have a lot in Boston, I don't think. They're in another city, not too far away. No, I'm not going to pick on anybody. All right, yes.
For people that are in recovery in these homeless shelters that have been in recovery for a long time, what are your plans for housing them?
Laura, can you yell that for me?
So, what is your plan for housing the people who are currently in recovery?
Yeah, I mean, I think that anybody, I mean, again, anybody who's here, I just talked to a gentleman that was trying to get into some housing, and we have a system set up now in the city with the help of all the providers for homelessness. We're working to find people homes. We've been able to house 1,800 chronically homeless people in Boston, but that's a question that we should talk. We'll hook you up with some people. There's people here that's their job. All right? Listen, thank you, everybody. Yes, sir. One last question. Status Long Island. I'll answer that offline. We have a way to go. We submitted over 800 letters of support to the Quincy Conservation Commission, the state, letting them know that there is support for Long Island, and we're moving forward. We're taking step at a time, day at a time, but we're going to get there. Thank you, everybody.